Hi, let's look at the WHO Periodic Healthcare Facility Assessment Tool, which aims to help healthcare facilities identify their AMS preparedness, develop a stepwise implementation plan, and monitor progress. The tool may be used as a periodic activity or integrated into existing reviews of the healthcare facility's AMR response. Responses may be gathered from individual or group interviews, observations in healthcare facilities, and data collection from healthcare facility records and documents. A verifier section has been provided to serve as a guide. The intended users are healthcare facility managers, AMS committees or teams, or AMS champions responsible for the overall coordination and implementation of facility AMS programs. Note that the fields with an asterisk mark are mandatory. The tool begins with basic details, such as the country and the National Health Authority, followed by the details about the respondent and, if required, details of the person completing the questionnaire. Then the dates of current and previous assessment, and the mode of assessment, in which you can select whether it is a self-assessment or an interview. Let's look at the various sections within the tool. The assessments ideally are conducted periodically to monitor progress over time. There are 6 healthcare facility core element categories for AMS programs. Each core element is assessed by a series of questions. Respondents need to provide answers to each question for a given period. You can select answers from the drop-down, which are the following. No, the core element is not in place and is not a priority. No, but a priority means that the core element is a priority, but there is no plan in place to initiate it. Planned but not started indicates that the core element is planned but no action has taken place. Partially implemented means that the core element is in place but it is only partially implemented, requiring further strengthening. Fully implemented indicates that the core element is in place and is fully implemented without requiring strengthening but needing to be sustained. Verifiers act as a guide for the respondents. Now let's look at the first healthcare facility core element, leadership commitment. There are 7 key questions that assess a healthcare facility's progress in this area. For instance, is AMS identified as a priority by the healthcare facility management or leadership? Are AMS activities included in healthcare facility annual plans? And so on. You then choose the corresponding drop-down on whether this core element is implemented or not. The second healthcare facility core element category is accountability and responsibility. There are 10 key questions that assess the progress in this area. They include questions such as, is there a multidisciplinary AMS committee leadership in the healthcare facility with clear terms of reference? Does the AMS committee meet regularly? And so on. The third healthcare facility core element category is AMS actions. There are 11 key questions that assess the progress in this area. They include questions such as, is there a standard treatment guideline at the healthcare facility? Are the guidelines reviewed and updated periodically? The fourth healthcare facility core element category is education and training. There are 3 key questions that assess the progress in this area. For instance, does the healthcare facility include AMS programs such as optimizing antibiotic prescribing, dispensing, and administration in the staff induction training? The 5th healthcare facility core element category is monitoring and surveillance. There are 6 key questions that assess the progress in this area. For example, are regular prescription audits, point prevalence surveys to assess the appropriateness of antibiotic prescribing undertaken at the facility by the AMS committee or relevant team? The 6th healthcare facility core element is reporting feedback within the healthcare facility. There are 4 key questions that assess the progress in this area. An example is, does the AMS committee or relevant team analyse and report on the quantities of antibiotics purchased, prescribed and/or dispense to prescribers and healthcare facility management. That completes the walkthrough of the Periodic Healthcare Facility Assessment tool. Filling out the sections in this tool will allow you to develop and monitor the implementation of a facility AMS program and action plan.